A new series of mass layoffs in the federal government began yesterday, and this time it's healthcare workers who are being targeted. These are Health and Human Services employees trying to get into work to learn if they still have jobs. The cuts could affect everything from food safety to research into deadly illnesses. Skylar Henry has the story.
Long lines snaked around HHS buildings Tuesday, with some employees reaching the entrance only to be told their access had been revoked and their jobs terminated. All told, the department says its workforce will be reduced from 82,000 to 62,000, which also includes early retirees and those who accepted deferred resignation deals. It's estimated the cuts will impact roughly 3,500 workers at the FDA, 2,400 at the CDC, and 1,200 at the NIH. Yesterday, protesters gathered outside the CDC's Atlanta headquarters. Among them, Barbara Tomczyk, who left the agency 2 years ago and whose husband, a CDC scientist, was one of the thousands who were laid off Tuesday.
When I worked there, we went through reorgs all the time. It was very thoughtful, methodical, but it was not like, cutting the head off.
HHS has defended the downsizing strategy, saying it will eliminate redundancies and save taxpayer money. But critics argue the workforce reductions have already gutted vital programs, including some aimed at stopping HIV and bird flu outbreaks, as well as anti-tobacco regulators and mental health and addiction experts. Dr. Celine Gounder is editor-at-large for KFF and a CBS News medical contributor.
What really upsets me the most is that I know people in this country will needlessly get sick and die as a result of these cuts.
Cuts to the Centers for Medicare and Medicaid Services are a bit more discreet, about 300 layoffs expected for that agency. Meanwhile, HHS insists that the services themselves won't be impacted. Tony?
Skylar, thank you very much.